So we learned bad surgeons like me, we learned good surgeons, we learned from professors, from pioneers of phacoemulsification, but one name is left to listen from: legend. So now I call upon the legend out here. Grover sir is here to bless us. No introduction, not even a line needed.
I wouldn't have come unless I knew I was the only speaker left, so I had to come with this. I've learned a lot because I make all the mistakes that every speaker spoke about, but I make some additional ones. So I'm going to speak about these additional ones. So communication is an art, a science, and a lot more. So we're going to talk about how communication difficulties can lead to difficulties other than all that we have spoken about. So let's begin by understanding what communication means and particularly what it means in the context of our communication with the patient with regard to cataract surgery. So either imparting or exchange of information by all means, speaking, non-verbal, and eye communication and all that. Why do we need communication, particularly in the context of when you are planning to operate a patient? It helps us better understand people, particularly important for us besides situations. It helps us with a lot of things, but most of all for us, for cataract surgeon, it builds trust amongst the two parties involved, the surgeon, the surgical team, and the patient. What we often neglect is the other components of communication. We all know about what verbal communication means, but it is the other language, what we communicate in terms of empathy with our eye contact, with a feeling of sharing what he's trying to communicate. That is, the non-verbal communication is very important. And the most important thing, as it is said here, is in communication is hearing what isn't said. So you have to understand the patient's psychology, his mind makeup, his thoughts, which he's not able to say in words. So as the previous slide said, empathetic listening is what is important. You need to be having a two-way communication, understanding what is going on in the patient's mind. The biggest communication problem is we listening normally in order to reply to that. Our mind is concentrated on what we're going to say in reply rather than on really understanding what the verbal and non-verbal communication is trying to say. Another important lesson is what Albert Einstein said. Communication should be simple, easy to understand. What we often say in jargons or in technical terms or superficially may not mean much to the patient. And you're able to do that once you understand a thing better. So that's why Einstein said, if you can't explain it simply, you don't understand it well enough. So putting things in simple words is a very complex thing. So let's come to the specifics of communication with a cataract patient. This communication needs to be preoperative, during the surgery, and postoperatively. And preoperatively, there are a lot of things which are communicating in your setup. Is the ambience, the displays, and then the communication that happens from your team down the line, right from the front desk to the optometrist, to what you communicate, to what the counselor communicates, and even afterwards when he goes through the optometrist, through the pharmacy and all that. So it is a whole set of communications which is important, and the impression that he carries or the knowledge that he takes back has a lot to do with the entire set of your environment and entire set of communication ability of each one of your people. So it is important to impart those lessons to everyone. So, one important aspect of communication is understanding the patient, and what we often forget is the attendant, because often the decision maker is the attendant. So, you have to understand his background relationship and also understand that this is the decision maker. For the patient, you need to understand, of course, we all talk about occupation, professional requirements, visual requirements, but these are some things which are only discerned when you interact with the patient. Many times, some of these VIPs say that, okay, we'll come only on the day of surgery and get operated. मैंने biometry करा ली है, मैंने दिखा लिया, मैंने pupil dilate करा के fundus दिखा लिया है. But I'm very uncomfortable unless I've met the patient, because you don't really understand the patient. You don't really know how to interact with him unless you have had a session with him, a pre-operative one-to-one with him. So that, I think, is very important. So you have to pick up the over-anxious patients, hypersensitive patients, demanding patients, and make your decisions accordingly. Of course, this is purely technical. We all know that you need to communicate nature of disease, options in management, pre-operative preparation, informed consent, nature of surgery, experience during surgery, what he'll feel, what we expect him to do during surgery, post-operative difficulties that he'll face, expectations, precautions, and financials. I think this is very important. Now, of course, consent needs to be very specific and detailed, and this, in today's era, needs no emphasis to this audience. And this, of course, has also been repeated to you several times, that you always try and not raise expectations. And some of those expectations come from the public कि आपका तो वहाँ ऑपरेशन पे जाना है और 5 मिनट में हो जाता है. Some patients come and tell me कि ये तो 5 मिनट की सर्जरी. मैंने कहा आप भी कर सकते हो, आप ही कर लो. So those kind of expectations, that it's a very simple surgery. Simple surgery का word तो कई लोग use करते हैं कि इतनी simple surgery है. फिर particularly if they've had a tough experience कि सबका तो बिल्कुल अच्छा हो जाता है, इतनी simple surgery है और मेरे कोई दिक्कत हो रही है. Obviously, you are the one at fault. So intraoperative, putting the patient at ease is very important for getting a good result, because only then he'll cooperate well. Especially topical के era में, it has become particularly important that patient is at ease and you have communicated, explained what the experience will be like, dimmed the light in the beginning when you're working with topical, then gone on to, and that your attendants, your assistants are in the habit of explaining some things when they're sticking the plaster, or the drape, and so on and so forth. And so some appreciation, some expectation that you have of him, if you explain to him, it makes for a huge difference. So just one sentence, lots of patients have said this, that the one sentence you speak in the beginning before you start makes a lot of difference to our, and of course, if it helps if old songs are playing in my OT, which they always do, because many patients are that age group where they appreciate the same songs that we do. So that is the difficulty for young surgeons. Okay, post-operatively, again, we need to be explaining a lot more, because that is where a lot of complaints come. If there is a system in your hospital of somebody calling up the patients on that day, it makes a huge difference. I try to implement it most of the time. Sometimes, of course, they forget, but an inquiring from them and somebody being available for a call, because unless that is present, they will come up with a lot of complaints about that. So you need to explain the difficulties that they will have. Now let's see, where do we go wrong? There are a number of inadequacies. We'll talk about these 4. One is that if we don't build enough relationship or trust, it's normally a 5-minute interaction, but those 5 minutes are enough for building a kind of trust. Most important thing for building that trust is whether you heard what he wanted to say, because one of the commonest feelings left in a patient is that he could not tell what he had, even if it is immaterial. You can see everything on his eyes, but that's not enough. I mean, that's the one thing that you learn with experience over the years, is that many 20-25% of the illnesses are organic, and 75% of it is with all the overlay of all the other parts of personality and so on and so forth. So this is very important. Of course, communication again helps you to understand what the patient's requirements are. Inadequate information that you are providing to him, we'll talk about this a little more, and inadequate post-operative explanation and chair time. So which all may help to have a patient who has expectations that are unrealistic. So communications, so inadequate relationship or trust building happens if you have not spent time with the patient. This has been repeatedly stressed. And intraoperative communication, those are the two times when you are personally going to interact with him as well. So those are the times when you can build this relationship, the feeling that this is a person who cares for me, which is what is going to matter in what happens post-operatively. And this is the job of the whole team, whether they've assessed the patient's requirements well in terms of decision making on what procedure to do and what lens to put and how to deal with him post-operatively. And if you've not given adequate information, many a times things will all go well, and you expect him to know a few things, you expect your setup to have conveyed a few things, but when anything goes wrong in the results, then this is what is going to matter, that this was not informed to me, that this particular complication was not explained to me, and so on and so forth. So then all these become very important, and financials often are very important in this. And then of course, especially when a complication happens, or there is a reason for patient to be unhappy, then this becomes particularly important, which is to have that extra chair time post-operatively. Maybe give a little priority to the patient who has an endophthalmitis, see him early, spend a little extra time with him. So this part of communication in those cases becomes particularly important, where there has been something which has not given a perfect result surgically. So appropriate communication at all stages holds the key to patients who are grateful and who are going to be your permanent ambassadors, or they're going to be your litigants. So I think communication will hold the key in choosing the right results for you. Thank you.